You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Kathy Biasi.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I'm your host, Kathy Biasi, and I'm an holistic nutritionist and a professional cancer coach. In today's episode, we are discussing what I think is one of the most fascinating and revolutionary discoveries in modern medicine, the link between the vagus nerve, the inflammatory reflex, and the body's innate ability to heal. For years, inflammation has been seen as a silent driver behind chronic illness, from autoimmune disease and depression to heart disease and neurodegeneration. But what if the body already has a built-in mechanism to control it? My guest today is Dr. Kevin Tracey. He is the president and CEO of the Feinstein Institutes for Medical Research at Northwell Health, a pioneer of vagus nerve research and author of The Great Nerve. A leader in the scientific fields of inflammation and neuroscience, his lab studies vagus nerve stimulation and bioelectronic medicine. His contributions include first identifying the therapeutic action of monoclonal anti-TNF antibodies and discovering the specific reflex control of immunity by the nervous system, called the inflammatory reflex. These discoveries launched the new scientific field called bioelectronic medicine, which investigates the therapeutic applications of vagus nerve stimulation to cure disease. Dr. Tracey, a neurosurgeon, pursued studies of inflammation after the mysterious death of a toddler from sepsis who was in his care. His lab has since revealed molecular mechanisms of inflammation and identified the use of vagus nerve stimulation to treat it. An inventor on more than 120 U.S. patents and the author of more than 450 scientific publications, he is among the most highly cited scientists in the world. He co-founded the Global Sepsis Alliance, is the author of Fatal Sequence, and is a national and international lecturer. This show is so information-packed, you really need to stay tuned and listen to it all. We explore how the vagus nerve acts as a communication superhighway between the brain, the gut, and the immune system, and how activating this pathway can literally turn off inflammation. You'll learn about the vagus nerve, the groundbreaking research that uncovered this connection, and the emerging field of bioelectronic medicine. Do stay tuned. We will be back in just a few minutes to speak with Dr. Tracey.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Kathy Biasi.
Welcome back to the Health Hub. Please do follow us on our social sites. We are on Instagram, X, and Facebook, and we are at the Health Hub RMC on those locations. Dr. Tracey, welcome to the show. Thank you so much for taking the time to be here with us.
Thank you, Kathy, for having me on. I'm looking forward to our conversation.
I would venture to guess when the topic of the vagus nerve comes along, many people may have not have heard of it, have a very limited understanding. So I think before we really get into your work, we lay the ground as to what the vagus nerve is, does, and how it's connected to our overall system.
The vagus nerve is a paired structure. So you have two of them, like two thumbs or two kidneys. It starts in the brain at about the level of your ears, and it travels down, one on each side, through your neck, across your chest, and into your abdomen. And all along the way, it's sending branches, fibers, to all the organs that you don't think about all day long. What it does is it carries signals back and forth, beginning in the body and traveling up to the brain, and then traveling from the brain back to the body. And these signals are the basis of reflexes that keep your organs functioning in a state of balance or health that we call homeostasis. Now, I said you have two vagus nerves, but actually it's much more complicated than that, because each of these quote unquote two nerves in your neck are like transatlantic cables or fiber optic cables that contain 100,000 individual nerves or fibers. So really, it's more correct to say that you have more like 200,000 vagus nerves than two. And the signals traveling in those 200,000 fibers are notifying your brain every second about all kinds of information that most people wouldn't think the brain is tracking. How much glucose is in your liver? What's your blood pressure? How fast is your heart beating? What's the oxygen content in your blood? What's the carbon dioxide content? All of this input from the body drives reflex responses that travel up and down in the vagus nerve. And this is how we're able to function with these complex organ responses in a way that's balanced and harmonious and homeostatic, healthy.
So this is sort of how it's all connected with the body. How is the vagus nerve connected with immunity beyond the information highway?
About 25 years ago, my colleagues and I in my lab here at the Feinstein Institutes at Northwell Health in New York, we made an accidental discovery that the vagus nerve is, in fact, a way to control, that the vagus nerve is, in fact, carrying reflexes that control inflammation. What that means is, what you said is correct. It means that there are connections between the brain through the vagus nerve to the immune system. And what we discovered is that the signals in these connections are like the brakes on your car, and they can slow down inflammation. And that led over a period of years of work, 25 years of work, and clinical trials led by a company that I co-founded called SetPoint Medical. That led recently to the approval by the US FDA of a vagus nerve-based device in patients with rheumatoid arthritis that has revolutionary implications for treating first patients with rheumatoid arthritis, but someday patients with other inflammatory conditions ranging from multiple sclerosis and inflammatory bowel disease, even to cancer.
How is that connection made to disease?
The connection, we've reduced the connection to a wiring diagram that we've mapped with sort of exquisite precision over 25 years. And everything I'm about to say now has been done either in my lab or replicated in other laboratories around the world. So there's very little controversy about our scientific understanding of how this works. What happens is when inflammation is present in your body, it activates the input in what we call the inflammatory reflex. That means that the presence of inflammation sends signals up your vagus nerve on the sensory side of the vagus nerve traveling into the brain. The brain responds by sending signals back down the vagus nerve. These signals originate deep in the brain at a place called the dorsal motor nucleus of the vagus nerve. These signals travel down into your abdomen, where the nerve endings terminate or stop on a collection of other nerves called a ganglia outside of your spleen. there, the signals activate a nerve that goes into your spleen, and inside the spleen, the electrical signals are converted to chemical signals, so that inside your spleen, nerves are now producing neurotransmitters with names like norepinephrine and acetylcholine. And it's the interaction of these molecules, norepinephrine and acetylcholine, with your white blood cells as they pass through your spleen that gently suppresses, if you will, carefully suppresses the amount of inflammation that your white blood cells produce. So what that means is the signals in the vagus nerve are an evolutionarily ancient. They're a hardwired system that evolved to protect you from inflammation. And because it's a protective system that evolved over millions of years, it does not cause side effects that we attribute today to the anti-inflammatory drugs that are widely used, meaning the vagus nerve pathway does not cause immunosuppression. So this gives tremendous hope and optimism for millions of patients who are currently taking dangerous immunosuppressive drugs, and they either don't want to continue taking them, or in many cases, these drugs are not giving them the clinical benefit that they'd hope to receive. And so they're walking around with rheumatoid arthritis, taking these powerful medications that is causing immunosuppression, but they still have signs and symptoms of devastating arthritic pain. Some patients now who've been treated with vagus nerve stimulation implants from Setpoint Medical, and they call that device the immunoregulator. There are some patients who've had tremendous success and are now enjoying significant improvement from their rheumatoid arthritis. Some patients also received not significant benefit, but noticeable benefit, and only a small fraction of patients, probably 20% of the patients who were treated with this new therapy, derived no noticeable benefit. So it's a real new way of thinking about treating inflammation based on this sort of deep knowledge that my colleagues and I around the world have developed about how the vagus nerve can control inflammation.
Would the vagus nerve be the cause of certain inflammatory diseases, or is it sort of affected by other things that are going on in the body, and therefore the vagus nerve's signals are not as they should be?
That's a really important question. That's an area of active research, again, by many different labs around the world. I will tell you both of those postulates are supported by some evidence. So in the first case, we've now seen a whole series of clinical studies, and some of which my colleague Sangeeta Sivan here in New York and I have done together. If you look at patients with severe inflammation, whether it's from rheumatoid arthritis or sepsis or inflammatory bowel disease, and you ask the question, is there evidence that their vagus nerve functions are impaired? The simple answer is yes. If you look at measures embedded in things like heart rate variability, which is it's not a perfect way, but it's one reasonable way to measure vagus nerve activity. Patients with inflammation have depressed vagus nerve activity. They have depressed heart rate variability. So, is that cause or effect? Well, if you look at families of patients with rheumatoid arthritis, and you look in unaffected siblings or relatives versus the general population, the unaffected siblings tend to have impaired vagus nerve findings on heart rate variability in advance of getting arthritic symptoms. Mm-hmm. So that's at least agreeable with your first scenario, that it's possible that the failure of the brakes in the vagus nerve, that vagus nerve dysfunction, allows or contributes to the onset of the inflammation. In the second scenario, there is clear evidence that inflammation can damage the vagus nerve, and we saw this in the COVID pandemic. And several groups, beginning with a group in Spain, in Madrid, reported the results of autopsy findings in victims of COVID. And when they looked in the vagus nerve, they found evidence that the virus had infected the vagus nerve, or at least penetrated the vagus nerve. And they found evidence of inflammation around the vagus nerve that damaged the vagus nerve fibers. Other studies have done sophisticated imaging using fMRI or ultrasound, looking at the vagus nerve in patients who survived COVID but were left facing the complications of long-haul COVID or long COVID. And once again, there's evidence in many of these long COVID sufferers, there's evidence of vagus nerve inflammation or vagus nerve damage. So there's a lot of work going on these questions because the evidence so far that's been collected points to the fact that these are important questions to be answered. Cause and effect related to vagus nerve damage and the onset of inflammation.
Could it not be a combination of both? There was a very interesting article I read about rethinking surgery, and especially abdominal surgery. And it only came up for a brief moment, but they did talk about damage to the vagus nerve through trauma in surgery. Is this a possibility, or was this not, this is not relevant?
Yes, anything's a possibility until we have proof one way or the other. I think there's some important caveats when people talk about vagus nerve damage. Mm-hmm. So the vagus nerve, as we talked about already, it starts very high up in your head. It starts in your brain at the level of your ears, and it travels all the way down to your bladder and your abdomen. So there's thousands of branches of the vagus nerve. Now, going back 2,000 years to one of the world's first physician scientists, Galen, he discovered that when he cut the vagus nerve in animals, in pigs and sheep and other animals, that when he cut the vagus nerve in the neck on both sides, it's fatal, causes the animals to die because the signals high up in the neck are carrying information to the heart and to the lungs and to all of your organs, and sudden loss of those signals can be fatal. When you cut the vagus nerve down in the abdomen, if you cut it way down away from the heart and lungs, then it's not fatal. And what you lose is the information that's being carried from the organs further away from the brain. Now, for years and years, for decades, a standard treatment of peptic ulcer disease was to cut the branches of the vagus nerve near the stomach, called the subdiaphragmatic vagotomy. Now, obviously, that's not fatal. It was done in thousands, if not millions, of patients worldwide. It was the standard treatment for ulcer disease. And what was observed in that is actually very interesting. It has been looked at again recently that those patients with a subdiaphragmatic vagotomy are actually at a lower risk of neurodegeneration, things like Parkinson's disease. And there's a theory that the origin of some forms of neurodegeneration may be in the intestines, and that the signals travel from the intestines up to the brain through the vagus nerve. And so by cutting the vagus nerve under the diaphragm, it's possible that conferred some protection against Parkinson's disease. So there's all kinds of questions here and not a lot of answers. I think attributing too much to the vagus nerve in a specific way is not a good thing without enough well-controlled clinical trials and mechanistic scientific studies. And that's really where we're at now. We're at a new phase of doubling down on these trials and on this research.
But it could be the missing piece not discussed in health issues with patients. Is that fair to say?
It's fair to form specific hypotheses and ask specific questions about specific conditions in a specific patient.
Okay.
And the reason I say it that way is actually fairly important. It's because if you go online right now and type in vagus nerve in your favorite search engine, you will find out quickly that there are billions of web impressions with the word vagus nerve. And the same is true on social media. Billions of social media posts. And it's fine for people to ask, as you are, ask these questions and probe what's known and what's not known. Where I push back on many of these posts is that you scratch beneath the surface and you find someone is making a recommendation to sell something or making a medical treatment advice based on evidence that is not well supported by clinical trials with randomization protocols that are carefully controlled and good statistics. And so what you find is a lot of people pushing agendas because they say, well, just hum and you've stimulated your vagus nerve and therefore you'll have less inflammation. Well, let's talk about that for a second. Why hum? Well, it turns out that in the neck, one of the branches of the vagus nerve that exits the vagus nerve and travels over to your voice box, it carries the signals that are really important for vocalization, for humming, for singing, for moving your vocal cords. Okay, great. So if the signals to move your vocal cords are in that branch of the vagus nerve and you hum, have you stimulated your vagus nerve? Well, technically, yes, but more properly, you've stimulated a couple hundred fibers of the 200,000. Now, have you also stimulated the fibers that go to your spleen to stop inflammation? I don't think so, because that's not how the nervous system works. We can all walk and chew gum at the same time because different fibers control different functions. Different fibers, nerve fibers, control your ability to walk, and different nerve fibers control your ability to chew gum. And the vagus nerve is organized the same way. Just because you're humming doesn't mean you've stimulated the fibers to your heart or your spleen or your intestines. So when someone says to me, I want to stimulate my vagus nerve and be healthy, I say, oh, really? Me too. I have 200,000 vagus nerve fibers. Which ones do you want to stimulate, and how are you going to stimulate them specifically? That's the challenge, right? And the opportunity is to use scientific tools and clinical trial designs and modern biomedical engineering advances like the immunoregulator from SetPoint, and we can ask these questions now in a way that provides meaningful answers.
How can we tell if the vagus nerve is possibly unhealthy, in need of stimulation? Are there symptoms that you, for instance, look at? Or is it we can try these therapies and see if there's an improvement?
That's another really complicated question. So let's take the simple side of it first. So the simple side would be, well, what is it that the vagus nerve does that we can measure simply and quickly and cheaply? And one thing the vagus nerve fibers to your heart do is they slow your heartbeat. So when you do things that are generally recognized as safe and good health practices, such as eat a balanced diet, get a good night's sleep, exercise regularly within the limits guided by your healthcare providers, avoid too much stress in your life, and practice healthy habits like meditation or cognitive behavioral therapy or hobbies that fully engage your mind, and maintain strong social and familial connections with friends and families in your community, giving back to the world, if you will. These things all tend to slow your heart rate, and a slower heart rate is actually one sort of all-purpose indicator that the vagus nerve signals to your heart are functioning in a healthy way. You can look at measures of heart rate variability, which you can get off of your wearable. There you have a much more sophisticated algorithm, and which is fine. The problem is not all the algorithms are the same, so you don't really know exactly what you're measuring. But other than that, it's very difficult in humans to measure vagus nerve function. It's very difficult because the functions are so deeply embedded into the reflexes that are controlling so many different organs.
Okay, fair. Let's take a break. When we get back, I would like to talk to you about your book, the reasoning behind it. I think people are going to be very, very interested in why you've laid the book out as you have. So everyone will be back in just a few minutes to continue with Dr. Tracey.
You are listening to The Health Hub here on Radio Maria Canada. A Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Kathy Biasi.
Welcome back, everybody, to the Health Hub. We are going to continue our conversation about the vagus nerve with Dr. Tracey. Kevin, the question that kept popping up in my head as we were talking is that not everybody can source you as the professional about the vagus nerve and the health of the vagus nerve. Where do we go with this information? Who do we talk to? And was this maybe one of the impetuses behind your new book?
It was absolutely the impetus behind writing this new book. The book's called The Great Nerve because that's what Galen called it. The guy I mentioned before from 2,000 years ago. He recognized the importance of this nerve. And anyone who went to medical school learned a little bit about the vagus nerve, and some experts in things like cardiology might talk about the vagus nerve once in a while in terms of the vasovagal reflex, the fainting that occurs when you get up too quickly, that kind of thing. But in general, despite the billions of web impressions, most people don't understand much about the vagus nerve, not even as much as we've talked about in the first 15 minutes on this show. The fact that there's now going to be a vagus nerve-based therapy to treat a condition as serious as rheumatoid arthritis, the fact that it works by reducing inflammation, the fact that this same approach it's not proved yet, but it may be useful in millions and millions of other patients with inflammation from other causes. I wrote the book because there's now so many people who are going to want to know about this and have significant questions. The book is organized to give answers up front to sort of the story of the science behind inflammation and the vagus nerve, as we talked about briefly already. But I then moved into what I call the practical side of the book, where I even have a chapter called FAQs. And these frequently asked questions are what patients can ask their doctors about their vagus nerve and whether or not they might be eligible for a therapy based on their vagus nerve. And
but before you go on, which type of doctor are you speaking of?
Yeah, to begin, it's going to be for rheumatologists, right? Because the FDA has now approved a vagus nerve-based therapy called an immunoregulator to be implanted in patients with rheumatoid arthritis. Now, patients with rheumatoid arthritis have been being treated with anti-inflammatory medications, some of them for decades, and no one's ever talked to them about a vagus nerve implant before because it wasn't available. Now it's in the United States, it's available as an FDA-approved therapy, and that means patients are going to want to know about it. They're going to know how does it work? Where did it come from? And so that's all covered in the FAQs. And the answers are for the patients and for anyone interested in the vagus nerve in general. But the answers are also for the doctors, the rheumatologists to begin, because most rheumatologists haven't thought much about the vagus nerve for, as I said, since medical school. But soon it'll be for other conditions. I fully expect you're going to see clinical trials for using this approach in inflammatory bowel disease. Kathy, we've already done it. We've already published clinical trials, small clinical trials, but the signal is very strong. There's a lot of patients who got better in those trials. There's preclinical trials for multiple sclerosis. There's preclinical trials for diabetes. There's preclinical trials even for some forms of heart disease and cancer. So I think you're going to see a tremendous amount of work, and then it will be lots and lots of different specialists who are going to want to learn more about the vagus nerve. So I tried to put all the information in an accessible format for the general public, for the patients, and for the doctors.
Elucidating all this information, I mean, the question that comes up in my head is, we're talking about inflammation really as the root of disease. I'm not going to make a blanket statement that it's the root of all disease, but this is a key piece to health. Are there, this implant that you talk about, first of all, is it a permanent one?
The implant that's being now FDA approved in the United States is permanent. It's about the size of a multivitamin. It is implanted in the left neck through an 1.5 or 2-inch incision at about the level of the Adam's apple. Once the incision heals, in the overwhelming majority of patients, you won't even see the scar. It'll be in the normal lines of the neck, the creases of the neck. And the device, it fires for 1 minute a day. Many of the patients receiving the therapy for 1 minute a day they sleep through it. They don't even realize that it happened. It has a battery and built in, and the battery is recharged by putting a collar around the neck like you put your phone down to charge that. Well, here you put the charger around your neck, and it charges in the battery inside your neck. It's a remarkable piece of engineering, and the fact that it worked so well, as I said before, in 80% of patients with no serious adverse events, is really a compelling case that I think a lot of people are going to want to try this. Recall, Kathy, as you probably know, the biologics, the anti-cytokine drugs like anti-TNF and anti-IL-1 that are currently being used to treat rheumatoid arthritis. In the United States, they can cost $100,000 a year. They're invasive. They have to be injected. And they have black box warnings, which is the most serious side effect that a drug can have. And so, look, some patients have had tremendous clinical benefit from these drugs, and that's wonderful. But that's half the patients. 50% of the patients taking these powerful drugs still are dissatisfied with their therapy. And so this vagus nerve approach now will offer an alternative for many.
Are you regenerating the vagus nerve with these electrical stimulation, or is it just kicking it in?
There's no evidence yet for long-term regeneration. And no, we're probably activating fibers that were previously not firing at full capacity. But we don't have all the answers to what happens long-term. The reason the reason we named the company SetPoint is we imagined 18 years ago when we named the company, we imagined the possibility that whatever the problem is, damage to the vagus nerve itself or damage to the circuits in the brain that are the basis of the reflex responses controlling inflammation, that if we could reactivate those circuits with small, tiny electrical pulses for 1 minute a day, that if we could reactivate these circuits, then through neuroplasticity, there would be an enhancement of these circuits, and they would start to function normally again, like when you change the set point on the thermostat in your house. That was what we thought would be the truly best possible outcome. And if that's the case, if you reset the set point and you reestablish those healthy reflexes that were impaired in these patients, might they then enjoy long-term benefit or remission from their disease? Now, we still don't know. We don't have all the mechanistic or scientific answers to whether that's happening, but I have met patients already who are years and years out from their vagus nerve implant, and many of these patients have turned the device off and no longer take drugs and are not even using the vagus nerve stimulator anymore. So it's possible. It's possible, and it's going to take years more work to know all those mechanisms.
Well, when we talk about inflammation as the root of disease, this almost gives an area of preventative medicine. Is that something that's in the offing?
Again, if it was me, myself, and I not making treatment recommendations for others, I personally think it's a great idea. The reason is what you alluded to before. So if you said inflammation without saying it's the root of all disease, I agree. However, let's look at what it is the root of. Every year on planet Earth, 60 million people die, according to the WHO. Of those people that die, the 60 million, 40 million of them die of heart disease, stroke, cancer, neurodegeneration, metabolic syndrome, diabetes, obesity, and other conditions related to inflammation. All of those conditions are either caused by, in some cases, or made worse by, and pretty much in all those cases, some type of inflammation. So I think it's fair to frame the question. You could prevent the inflammation from causing the damage. If you could prevent inflammation from contributing to all those conditions, would we improve health span? Would we prolong lifespan? And the answer to me is maybe. And so another way to think about it is when you think of a disease or a condition that progresses over many years, can you think of any such condition where treating late is better than treating early?
Mm-hmm.
I can't. And so now the question is, if inflammation, does it progress as people age? It does. There's a condition some like to call inflammaging, which is the higher burdens of inflammation that you find in older people versus younger people. So is inflammaging contributing to the diseases of aging? And the answer is maybe. If you could prevent inflammaging, would you prevent the damage of those diseases? The answer is maybe. So now it's back to your point. Do I think someday people will be looking for vagus nerve-based therapy or stimulate or implanting devices on their vagus nerve to prevent inflammaging? I think the odds are pretty good that that'll happen someday.
Is this technology what you refer to as bioelectronic technology?
Yes, it is. So we can answer, I think, the definition first of what is bioelectronic medicine. So we define bioelectronic medicine as a convergence between molecular medicine, which is how we start by making drug targets and disease mechanisms, converging with neuroscience, converging with biomedical engineering. And that's what we define as bioelectronic medicine. In other words, it's building devices to target the body's nervous system in order to have the nerves deliver the therapy to the drug target. And it's very specific and very powerful.
This whole area, it seems to be revolutionizing as we speak. You know, we didn't talk about disease with respect to our nervous system. To me, I mean, obviously this is your life work, so this is something that's very familiar to you. But for the common folk, this whole area opening up with nervous system tied to immunity, it could really click and answer so many questions that, I don't feel well. All my tests are coming back, but I just don't feel well. Nobody tests for this. I think it's so exciting and so potentializing, if that's a word. Is this sort of the crown jewel? Is this book sort of the crown jewel of all your areas of research? Or is this is just scratching out at what you've accomplished?
This book tries to tell the stories that emerged over 30 years of work with brilliant colleagues, as I said, here at the Feinstein Institutes in my lab in New York, as well as in laboratories around the world and in companies like SetPoint that hire dozens, if not hundreds of people to do huge clinical trials to bring all this to reality. I think what's often overlooked in science and in medicine is how long it takes to move an idea from a patent paper to a laboratory experiment to a company to a clinical trial to a regulatory process to a product. It takes a long time, and it's not because everybody involved doesn't want it to go fast, and it's not because everybody involved doesn't want it to be successful. It's because it's complicated, and it's because there are rules and regulations, and there are expenses. And so to write a book about one project, which is what this book is about, there's many other projects in the lab that Sangeeta, Siobhan, and I run together. We have many other projects that haven't been included in this book, but maybe someday there'll be a book of their own. That would be my dream.
Is there anything, are you continuing with this work, this body of work, or are you branching out into something new that, we are looking forward to hearing about in a few years?
Well, there is new stuff, but of course I can't tell you on the radio. I can't even tell you privately some of the things we're doing. So we'll put that aside.
Okay.
And hope there'll be a conversation you and I can have someday about these future projects. But we're still very engaged in bioelectronic medicine and in vagus nerve based therapy for rheumatoid arthritis and other conditions today. And in fact, at Northwell Health, which those of you in Canada may not be familiar, but it's the largest healthcare provider in New York City and state, sees more than 2.5 or 3 million patients every year. It's the largest employer in New York City and state, and the largest nonprofit employer in New York City and state. And so when you look at what Northwell is doing in this space, it's actually remarkable. We launched a clinic, a new clinical center for bioelectronic medicine. We staffed it with administrators and patient navigators to help guide patients through this complex new pathway. I mean, patients, if you think about it, if you have rheumatoid arthritis, you would see your rheumatologist and you would get a prescription, and you get the prescription modified every 6 or 8 weeks. And that was your, and you go for your therapies, your injections, and that was your, but now if you're eligible for a vagus nerve stimulator, you need to be assessed for your eligibility in the protocol. You need to meet a neurosurgeon. You need to have an insurance company or governmental authorization for the therapy. You need to schedule the surgery. You need to have the surgical follow-up, and then you need to have the device being managed. So it's all new pathways. And so to organize these pathways in a patient-centered way, we opened this new center. But by having a new center for bioelectronic medicine focused on patients, it also allows us to begin additional clinical trials, not only with the SetPoint device, but with other bioelectronic companies who have devices to treat things like sleep apnea, rehabilitation from stroke, and other conditions that are already FDA approved, like depression and epilepsy. So there'll be a lot to do in the vagus nerve space for many, many years, if not decades to come, and we're very engaged in that.
Does bioelectronic medicine go beyond the vagus nerve? Like, are we going to see in 20 years, we're just going to have some sort of a plug-in, something that's not as invasive as putting something in your neck? The whole method of charging that piece sounds like it could actually evolve into some sort of a stimulation that's not as invasive. Do you see this coming?
I see a future in bioelectronic medicine where there will be many, many, many different options. There will be options in the future to have devices implanted in the vagus nerve, as there are now, but also on other nerves in the body, potentially the splenic nerve or the vagus nerve in the liver, the hepatic branches of the vagus nerve, or vagus nerve branches in the stomach and other organs. There are people advocating for non-invasive approaches to stimulate nerves, particularly the vagus nerve. As of today, there are no non-invasive devices that have been proven to stimulate the vagus nerve under FDA approval. They stimulate the skin. They put electrodes on the skin, and those by definition are like TENS units, transcutaneous electrical nerve stimulators. These TENS units have been around for decades. Some of these TENS units are branded as vagus nerve stimulators, but there's no evidence that the electric current travels deep through the tissues down to where the vagus nerve is. In fact, there's evidence that the current can't travel that deeply.
Fair.
However, you can stimulate the vagus nerve non-invasively using focused ultrasound, and that's an interesting experimental strategy. Sangeeta and Stavros Zanos here at Feinstein and I have co-authored a study where we used focused ultrasound, which dives deep into the tissues and can be used to stimulate branches of the vagus nerve near and around and in the spleen. And that's interesting for future development, but those are not available today. So what you're going to see is a tremendous amount of additional work, a tremendous amount of additional clinical trials, because there is an enormous unmet need to treat these conditions related to inflammation that we're talking about. And by harnessing the power of the nervous system to do that, there's a tremendous interest in scientists and clinical researchers in seeing if they can do it with devices both invasively and non-invasively.
I'm gonna push the limits of our show here, but I have to ask, assessment for vagus nerve therapy, how is that executed?
Oh, well, right now it's fairly straightforward because the FDA guidelines have said in order to be eligible for this device, the immunoregulator, then you have to have rheumatoid arthritis of a particular type. You have to have been on these particular medications and either not tolerated those medications or not have had a good therapeutic response. And you have to be in a certain age group. So it's defined right now by the FDA guidelines. As the research expands and the use and familiarity with this device expands, I fully expect those guidelines will broaden. And as we get additional clinical trial data in other indications, I think other conditions will be being treated that way as well.
Oh, I just have so many more questions. Unfortunately, we're right up against the clock. How can we access your book? Dr. Tracey, do you see patients or can we get more information on what you're doing? Can you give us that info?
I do not treat patients anymore,
Okay.
Kathy. I'm a neurosurgeon. I retired from clinical practice many years ago to put my attention on these projects, on my lab, and on these getting these projects over the finish line, working closely with SetPoint and with others. And so I don't see patients. However, on the Northwell Health website, there is patients who have questions about this can look there under the Clinical Center for Bioelectronic Medicine. That's easy to find by Googling Northwell Health and Center for Bioelectronic Medicine. As far as get where to find my book, it's, as they say, wherever books are sold. It's online and it's in many bookstores as well.
Well, as I told you at the beginning of the show, I have read excerpts and I've read all about you, and I think it's such a fascinating area, and I can't wait to get my hands on that book because it just, honestly,
Kathy, I'll send you one.
Thank you.
Sorry we didn't send it before the show.
But honestly, this resonates possibly with so many people. I just think it's such a great area to have a little bit of understanding. And I know that it does take time to get these therapies out, to get the trials done and so forth. But I do think that having conversations and making people more aware does a little bit to push the envelope. So I'm hoping that allowing you to have this conversation with us is a good step towards people understanding and grab the book, everybody, because I just think it's an area of health that we're just starting to see shades of light from. So Dr. Tracey, thank you so much for being on the show. I truly do appreciate you spending the time with us.
Thank you for having me on. It's been a great conversation. I appreciate it.
Thank you. Everybody, we'll talk to you next week on The Health Hub.
You have been listening to The Health Hub, hosted by Kathy Biasi, here on Radio Maria Canada.